Hello everyone and welcome to Your Whole Health with Dr. Taz. November is National Alzheimer's Awareness Month, and if you have a family member that maybe is suffering from Alzheimer's, you know far too well how difficult it is to see them retreat into their silent world. What I'm hoping today is you can walk away with a few tips about this disease and things that maybe will help that loved one fight their way through it. Let's try to connect the dots to begin with. Now remember, Alzheimer's is a major disease for this country. Almost 5 million people suffer from it, and it is the 6th leading cause of death. One of the things that's the most frustrating about Alzheimer's is that we don't have a lot of medical options to take care of it. Most doctors are usually involved in some sort of medication management, looking at different medicines to handle the different symptoms associated with Alzheimer's. And what all doctors agree on is that prevention is key. So let's try to bridge the gap in where maybe integrative medicine fits in. One of the first things we know is that Alzheimer's is a disease of inflammation. So if you already have an inflammatory disease like diabetes or heart disease, then we know you're at higher risk for Alzheimer's. We also know that Alzheimer's often results from a lack of oxygen to the brain. So if you're not exercising or really active, or your loved one is not very active, we know that they're not going to do very well in terms of turning their Alzheimer's disease around. Secondly, or thirdly actually, we really want to make sure that you or your loved one are a nutritional powerhouse. We know that there are key ingredients and key nutrients that protect the brain and help prevent Alzheimer's. And the final concept to really grasp and get a hold of is as we become more isolated, or we retire, or we become disengaged, or you have a major trauma and you start to isolate yourself, then you're at higher risk for Alzheimer's. So what can you do? You know all the information, you've got the concepts down. How do you make it practical? How do you really make it realistic? Well, number one thing, really try to make sure anyone suffering from Alzheimer's or at risk of Alzheimer's is on an anti-inflammatory diet. And when we talk about that, we really are very serious about it because we know it reverses inflammation and it really puts you a step ahead. And these are things to look at not just when you're 60, 70, or 80 years old, but maybe even starting as early as 40 or 50, so you really are ahead of the game when you're trying to prevent this particular disease. So lower gluten, lower dairy, keep your sugar content very low, and really work hard on getting those good healthy fats into your system. We know that protects the brain. Concept number 2 is to exercise. There's no easier way to get oxygen to the brain than to keep that blood flow moving. You want to have good blood pressure numbers, you want to have great circulation, and you want to keep moving on a daily basis and have an exercise regimen that you can turn back to. The third piece is to really be a nutrition powerhouse yourself. Really watch your diet, but more importantly, maybe think about supplementing if you know Alzheimer's is a disease within your family, or again, you have a loved one suffering from Alzheimer's, think about supplementing, maybe with a B vitamin, an omega-3 fat, or high-dose vitamin E. These are things that even in research show make a difference in Alzheimer's outcomes. And finally, probably the most important, is get engaged. If you have a retired family member that has Alzheimer's, or you're worried that you're at risk for Alzheimer's, stay active, stay socially active, stay mentally active, stay involved in your work or in a hobby, but really keep a great community around you so your brain and your neurons are functioning throughout the day and you're not at risk for becoming disengaged or really allowing those neurons to rest. I hope these tips have been helpful. I hope we've helped to kind of connect the dots and bridge the gap in your understanding of Alzheimer's, and I hope you can take this information and really make a difference for yourself or for somebody that you love.